Hoosiers, thank you for joining us. We'll get right to it. We've got 3 or 4 updates, and we'll start as always with Dr. Box. You've got some testing updates for us and the Regenstrief information as well that we've all been looking forward to.
Absolutely. Thank you, Governor. Good afternoon, Hoosiers. Today we reported 452 additional COVID-19 cases across the state of Indiana, which brings us to a total of 39,146, the total number of Hoosiers who are known to have had COVID-19. We also reported 16 additional confirmed deaths. To date, 2,214 Hoosiers have died of COVID-19, and another 182 are believed to have died of this disease based on their clinical diagnosis. We have also seen more than 335,000 Hoosiers get tested for COVID-19, which is up from nearly 291,000 just a week ago. That includes nearly 50,000 people who have been tested at our statewide Optum Serve sites. Starting Monday, we are opening Optum Serve sites to anyone who wants to get tested, regardless of whether you have symptoms or fall into a risk category.
Would you say that one more time?
I know you've been waiting for this.
Pardon my interruption.
So starting Monday, we're opening all of our Optum Serve sites to anyone who wants to get tested, regardless of whether they have symptoms or they fall into a high-risk category.
I thought I heard you right.
We recognize that this is a significant change from our focus on high-risk individuals and those who are symptomatic. But our testing capacity has improved significantly since the start of this pandemic, and we want Hoosiers to take advantage of that. What this means is that if you work or you live in the state of Indiana, you can get tested regardless of whether you're having symptoms or at high risk. The state is still keeping our focus on vulnerable populations, high-risk individuals, long-term care facilities, and the workforce. But you can find testing sites on our testing map at www.coronavirus.in.gov. If you live in another state but work in Indiana, you must call 888-634-1116, and that's on our website, to schedule an appointment. We also are now able to test children under 12 at these sites. The bottom line is that any Hoosier can get tested, period. We continue to maintain our ICU bed and ventilator capacity across the state, with more than 38% of our ICU beds available and 83% of our ventilators currently available. About 13% of ICU beds are occupied by patients with COVID or COVID-related symptoms, and about 4% of ventilators are being used by COVID patients. I want to share the latest data from our partners at Regenstrief regarding statewide hospitalization and recovery as we enter stage 4. Regenstrief has now looked at over 37,694 cases. Of those, 26% of those individuals visited an emergency department, which is unchanged from last week. A total of 6,314 were hospitalized, which is 17% of all the positive cases they reviewed. Of those who were hospitalized, 21% were admitted to the ICU, and that represents a positive percentage of 4% of all our positive patients. 73% of patients have been discharged. Of the remainder, 8% are believed to still be hospitalized, and nearly 19% are known to have died while hospitalized. Regenstrief also, and that's 19%. Regenstrief also estimates that 73% of patients have recovered, which is an increase from 67% last week. I also want to point out an enhancement to our website that will go live later this afternoon. Throughout this pandemic, we have been working to increase the data that we're able to share on our dashboard to help Hoosiers better understand where cases are occurring and who is being impacted by COVID-19. The Indiana State Department of Health normally analyzes data at the state and the county levels because we have found that when you go below the county level, numbers often get too small, and they are either non-identifiable or they don't provide enough information to inform public health actions. But we recognize that there's an interest in more granular data, and that in some cases it can help guide as where we put testing sites across the state and drive-through clinics. It also helps us to reduce the transmission of COVID-19. To make that happen, the state, through MPH, produced a map that breaks down positive test counts by zip codes throughout the state. There are some limitations to this data. If there are fewer than 5 cases in a zip code, or a zip code has a population below 1,500 people, the counts will be suppressed. Some zip codes have no cases. Zip codes often cross county lines, so zip codes counts won't align with county-level counts in most cases. We're grateful for our state partners at the Management Performance Hub who have worked incredibly hard to provide this information. We will be posting it on our dashboard later today and plan to update this weekly. Finally, I want to remind Hoosiers to be safe as we move to stage 4. I feel a bit like a nagging mom, but I'm going to remind you that COVID has not disappeared, and we need to continue to protect ourselves and those around us, especially our most vulnerable populations. Thank you.
Thank you, Dr. Box. Peter, you want to get us updated on what folks can expect at the local BMV branch kind of leading up to July 1 and then after?
Absolutely. Thank you, Governor. As you know, the BMV announced earlier this week that we'll resume walk-in service beginning this coming Monday, June 15th, to serve as many Hoosiers as possible in a safe and efficient manner. Opening to walk-ins will help us work through the backlog of folks that we know need to visit a branch. We understand you have been trying to get into our branches and have been using every available appointment that we've been able to put on our system. With walk-ins opening next week, we will continue to support appointments, but the number of appointments we offer each day will be reduced to ensure that we can process everyone at the branch safely and efficiently. These changes are an important next step to expanding the services for Hoosiers and to get transactions completed. Branches, since the public health emergency started, have been operating on an extended 6-day-a-week schedule. Starting on Monday, with accepting walk-ins, our branches will return to the operating hours that they had before the pandemic started. For most of our branches, this means that we'll be open Tuesday through Saturday. So we strongly recommend that you check the website for the hours of your branch, as some branches operate Monday through Friday. When you do visit a branch, your experience might look a little bit different. We are limiting the number of customers that come into a branch to ensure that we have proper spacing in our waiting rooms. We also ask folks to wait outside socially distanced as they wait for capacity to become available inside the branch. And we are going to limit that only one customer can be permitted at the counter to do the transaction unless the customer is a minor or a person who needs support. And there'll be signage at the branches helping direct customers on what is the entry point and exit points of the branch. If you are coming to the branch to do a knowledge exam, we're going to ask you to please come in plenty of time, as we want all knowledge exams to start 1 hour before we close to ensure you have plenty of time to complete the exam. All transactions will be available at our in-branch offices, but we are still not doing drive exams. As we noted earlier, we know that there are a lot of folks who need to get to the branch, and if you can do your transaction online, we strongly encourage you to go to mybmv.com or to visit one of our 24-hour kiosks. Our team is working very hard to bring back drive exams, and so by the end of June, we will start rescheduling the individuals who had appointments on our books and had to be canceled due to the public health emergency. Once we have scheduled all of these individuals, we will open up the scheduler to accommodate new driving skills exams. We ask for your patience, as we're wanting to both protect Hoosiers and our employees as we start bringing drives back. Our website has a lot of this information under our frequently asked questions, and we encourage and we will continue to post updates there and on social media, and ask you to continue to look for that information.
Thank you, Peter, very much. Fred, at the Department of Workforce Development, Commissioner Payne, it's Friday, so you've got Thursday updates to share.
So we still see a continuous decline of initial claims filed weekly since our peak back in March. So for the week ending June 6, we saw 23,604 initial claims filed. Since March, our unemployment insurance program has paid out approximately $2.6 billion in benefits. That amounts to about $667 million in state benefits and about $1.9 billion in federal benefits. In June, so far, we've paid out approximately $259 million in benefits. Our call center interactions exceed 2.2 million since April, with about 123,000 so far in June. Our strategy of adding additional staff and technology continue to significantly reduce the call wait time. Last week, we had a call wait time right under 15 minutes. I want to spend a little bit of time here talking about our Work One centers, or the Work One centers around the state. The Work One locations provide employment and reemployment services throughout Indiana. Work Ones are operated by our 12 strategic workforce development board partners throughout the state. As employment and reemployment centers, their focus is providing services related to, among other things, job training, job and work search, resume writing, resume building, supportive services, which include resources and equipment needed for a new job. What our Work One centers are not is the unemployment office. Unemployment services are centralized and provided through our online uplink system, and our centralized call center provides the needed support. So awareness of the services provided and not provided at the Work One locations, that will assist you in the allocation of your time and your resources. We want to make sure that you're continuously aware of the job resources that are available throughout the state. Please visit our website for updates on virtual job fairs and other resources available to you. As was reported or shared with you on last week, we continue to work on our rapid recovery plan for Hoosiers. You can visit the online hub, yournextstepin.org. As a reminder, our state, just like many other states, have seen thousands of claims filed. We pay more than $2.6 billion in claims and benefits. We'll continue to ensure that each eligible Hoosier is provided benefits, and every Hoosier who's interested in a job or career change or some related tools to enhance their job or their career, we want to make sure that we're connecting them to those resources. So go to our website for some of those resources. Thank you, Governor.
Thank you, Commissioner Payne. And Commissioner Rob Carter, you gave a brief update, you and Dr. Kristen Doss, earlier today to some folks here, and I just commend you on the job that you've been doing over the months in our facilities throughout the state of Indiana. But these numbers show a good trend. Could you share them?
Thank you, Governor. Rob Carter, Department of Correction. Of the roughly 1,014 offenders and staff that have tested positive, 932 of those have recovered. It's over 90%, so we're real happy with that. We haven't had a COVID-related death in over 2 weeks, and that's really good news. We're doing quite well right now. I want to shout out to my staff, central office staff, the field staff, custody, and my wardens have done a heck of a job. And especially want to thank the frontline medical staff at each facility, and also the strike team from the Department of Health. We couldn't have done it without the State Department of Health. And on top of that, we're still making PPE at our facilities, and so far as of today, we've made over 200,000 masks and continue to manufacture hand sanitizer, and so we're doing pretty good.
Still doing our gowns too? You were doing
Yes, doing gowns and masks and face shields.
Perfect. Thank you, Rob.
Thank you.
With that, Rachel, we'll go right to the Q&A.
Eric Berman, WIBC.
Good afternoon, Eric.
Afternoon, Governor. I think my question is for Dr. Box. As far as the testing expansion on Monday, there's 200 sites and those aren't all OptumServe sites. Does that apply only to OptumServe? And what do you hope to gain from this other than perhaps peace of mind for those who can get themselves a test?
So Eric, each site, if you look at our website and hover over that, it'll tell you what the requirements are. Some of those sites require an order from a physician. Some of them you have to be symptomatic. Because I have that standing order, if there's no particular requirements, a site may be willing to do that testing, but I know the Optum sites will do that. Our drive-through testing will do that. What do I hope to gain from that? I think a big part of that is that peace of mind, those individuals that really have been concerned all along and are just not going to be comfortable until they're able to test themselves and know they're normal or negative. What I would say, and I need to caution everyone in again, is that just because you're negative today doesn't mean you couldn't be positive tomorrow or even 12 hours from now. And so you need to conduct yourself always around others like you think you're positive, because you could be positive and asymptomatic. So that means wearing your mask, washing your hands, social distancing. That has always been my biggest concern about this.
Kathy from the Ferdinand News.
Afternoon, Kathy.
Good afternoon. It's Friday, so it's a good day.
That's right.
And my questions again are for Dr. Box. I'm wondering, and I've never felt like this has been clarified anywhere that I've read. We had a little bit from our health officer today, but say you find out you have met someone who has tested positive, whether they're symptomatic or not. How long should you wait to be tested? And then how long are people presumed contagious, asymptomatic or not? Like, I know they say maybe 10 days back to the workforce, but are there any statistics, or have they been studying? I'm sure they are studying how long you are contagious once you've contracted it.
So Kathy, the question about when you meet someone who's positive, it's really about, was that a close contact? Were you within 6 feet for over 15 minutes with that close contact? And then if that, by the time you find out they're positive and you've been 3 to 5 days later, you can go get tested at this point if you're concerned. The situation is, if you have been in close contact and we've asked you to quarantine for 14 days, just because you go on day 5 or 6 and get tested and you're negative does not mean you can come out of quarantine. So you still need to quarantine that period of time that we ask you to do. Now, if you would be positive and you remain asymptomatic, then you could be back within 10 days. How long are you contagious? That's an excellent question. And what I would say to you about that is that we have had individuals that, the CDC's original recommendations were 2 negative cultures within 24 hours of each other, nasopharyngeal, so PCR, not truly a culture, but doing a PCR. And if those are negative, then a person can return. But what we found is that many people, even 14, 21, 25, we've had the longest I've heard is 55 days out where they're still testing positive. So the CDC has gone back and actually done studies to show that beyond 14 days, even if you may be positive in your PCR, in that RNA that we're finding there, or DNA, it does not mean that you are shedding actively replicating virus, so you should not be infectious.
Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon. My questions are for Dr. Dan and Dr. Box, most likely. A majority of states are now naming specific facilities. Several of them are actually posting updates daily when it comes to nursing homes and the spread of COVID-19. After the boondoggle that was the CMS release with some of the inaccuracies, a lot of Hoosier families still don't have a complete picture of how COVID-19 is spreading in homes, and they can't compare their home with another home and get kind of an idea about region by region. So are you rethinking whether or not the state will create its own dashboard like the majority of states in the nation?
Dr. Dan's with us.
Sure. So to answer that question, we required, and that's what we did on the family communication document, that those facilities where there's that they communicate daily to the residents and their representatives what the status of COVID in that facility is. And the reason that's really important is it's important to know when there's an outbreak. And in many ways, that's what the CMS data is measuring as well. Are there new cases that are developing? Because that is the information that both the resident and the family may want to know, depending on whether or not that's going to prevent them from visitation, or whether or not they should consider whether or not they want to have their loved one in the facility. So that's the critical information. That's what we have been collecting the whole time, is are there new cases in the facility? And then we use that information to go in and to provide both resources in terms of testing and PPE. So in terms of that, we're going to continue to do that. We still believe that that's the most important communication that occurs. If somebody is looking for a new facility, our guidelines also mandate that those facilities let those individuals know as well what the COVID status in that facility is.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon. How are you all doing today?
Good, thank you. Yourself?
I am feeling fine and feisty, so it is a good Friday. So my question is concerning contact tracing. So there's been several colleges and other organizations that are offering free classes for this. So my question is, would this ever be considered a job for Hoosiers, as there are many individuals who are unemployed? And then also, what would your advice be to Hoosiers who may be back to work but are now underemployed, meaning maybe they had two jobs, maybe one was better paying than the other, and now they are only back at the job that doesn't pay as well?
So I'll let Fred Payne answer the second one. With regards to the contact tracing, what I would say about that is that we have had very skilled, highly educated people that have actually applied for this job. And still, it requires a lot of training just to help them understand the appropriate questions to ask, what a contact is, you know, what we're looking for, the education that needs to go in around quarantine and isolation. So yes, I think it would be a great job, because I don't see us being out of this in the near future. We do contact tracing even at a time when we don't have pandemics. So this is something that goes on not at the scale to which we are contact tracing right now, but certainly in our health departments across the state on a regular basis.
In terms of your question regarding job pay and whether or not a person could take a job with less pay or more pay, that boils down to an individual choice. One of the things that I would add to that is one of the reasons why we're focusing on our rapid recovery is to ensure that if there is a Hoosier who desires to have a job that may pay a better wage and they want the training for that job, we have the resources available for them to do that. And there's no better time than the present for individuals to look for that training while we have opportunities to pay for it and to defray some of that cost.
Yeah, and Meredith, I would say that this is always a concern. It was a concern whether you're at 16.9% unemployment or you're at a 3.2% unemployment when we were trying to upskill folks and train folks for those 90,000 plus unfilled jobs, you know, at the beginning of this year. And so this is always going to be, how do you prepare for the future? As Commissioner Payne just articulated, we have the resources. If you're looking to make a career change or skill up in the career that you're in, we have resources for the employee and for the employer.
Adam Van Oostel, Hannah News.
Afternoon, Adam.
Hey, Governor. There's been so many additional expenses you guys have had to take on with the contact tracing and the testing and the call centers. Are you finding that you're having to spend down the rainy day fund at this point?
Yeah, I'll call on OMB Budget Director. And Chris, if you would expand, not just to his question, but in addition to the reserves, but also the CARES Act and how delaying those tax collections in April that were pushed back to July, just kind of how it all the pieces are fitting together.
Sure. Chris Johnston, Office of Management and Budget. And so, Adam, if you recall, last Friday, I delivered some unfortunate news regarding our revenue forecast, and so we reported that we were $1.2 billion behind our forecast through May. And June also is a large revenue month for the state of Indiana, because there's a lot of estimated payments that are made. So we are not optimistic about the month of June either. And so an early estimate would be that we close the fiscal year probably approaching $2 billion behind our revenue forecast. And so based on a total revenue and expenditures of $17 billion, that's a pretty sizable, 10% hit. So as far as the actual expenditures, yes, we are, because of that fact, we are drawing down our reserves. As you recall, also, we put a provision out to all state agencies to cut their expenditures by 15%. And we've also put on hold and suspended several capital projects that the state was considering. So part of all of those actions are trying to maintain a positive balance and adequate reserves for the next fiscal year, as well as setting up for our budget discussion that will start next spring. As far as the expenses, we are incurring a lot of expenses, but so that is a combination. We do have the good fortune of the federal assistance through the CARES Act of covering a lot of the contact tracing and the enhanced testing that's going on out there. There are also other provisions to cover some of these expenses. So as far as direct expenses, we were in pretty good shape as far as covering those. It's really the economic impact that resulted from this sort of self-induced coma to the economy that we're working our way out of that's going to have the more lasting impact.
Yeah, and I would just say, Adam, that I'd rather have a surplus than not going into this. Had an opportunity to talk with some of my gubernatorial cohorts earlier this week, and we were talking about the status of our state's balance sheet. Minnesota Governor Tim Walz talked about how they went in with about a 2.9% surplus or reserves, and how he was able to get to the other side as well, just like the same approach that we're taking. But it really does underscore the need to fix your roof while the sun is shining and not wait till it's raining, because if you wait or you spend it all the way down and you truly go into an emergency and everything is cyclical, it may be too late.
Michael with WBEZ.
Good afternoon, Michael.
Good afternoon, Governor and Dr. Box. My first question is for Dr. Box. Dr. Box, what are your major concerns with casinos beginning to reopen in Northwest Indiana and elsewhere around the state? And Governor Holcomb, my second question is for you, and it pertains more to some of the protests that occurred throughout the state a couple of weeks ago or a week ago. I covered two of them in Northwest Indiana, and we had people showing up with guns, and I don't know if I would describe them as counter-protesters, but they did have guns, and I understand that they may have a right to do that under the Second Amendment, but do you have concerns of what message that may send to the peaceful protesters?
You want to go first?
Sure.
When we look at the casinos reopening, it's the same concerns I would have over any enclosed space where people are going to be touching the same surfaces over and over again and potentially laughing and singing and having a good time and potentially not wearing masks. So I think that it's all about keeping the number of people down. It's all about wearing your masks. It's all about social distancing. It's all about cleaning the machines over and over again, alcoholing your hands, not eating unless you've gone and washed your hands. So those are the same concerns I'd have if as we reopen bars or restaurants where people stand around together for a period of time.
Yeah, and I would just say that to please express your rights, whether they be the First, Second, whatever amendment for that matter, but whether it be the First, Second, your freedom to speech or assembly, or your Second Amendment, to do it peacefully and to do it safely. The expression is what this country was founded on. And so we want to encourage peaceful, law-abiding expressions of our rights.
Lindsay Erdody, the Indianapolis Business Journal.
Hello, Lindsay. Good afternoon.
Good afternoon, Governor. This morning you announced that the Department of Labor Commissioner is resigning, and I'm wondering if you can comment on whether that departure is related at all to the handling of the Amazon death investigation.
I can, and it's not. Rick Rubel served actually two of my predecessors in their administrations, and left the department in great shape. And I appreciate his more than 2 decades service and wish him well in whatever's next.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. I had 2 quick questions. The first is I'm wondering, are you guys sending any much of a mixed message by saying you need to continue to social distance and limit excursions, but then opening everything up at the same time and saying you can go to a theater, you can hang out with 250 people? And then the second question is, inquiring minds would like to know what you were doing at Joann's Fabrics.
We asked the same thing, Nikki.
You can't take both of them. So you take the first one, and I'll maybe piggyback on that and answer the second.
So Nikki, I think that we're not sending a mixed message. Our message has been extremely consistent all the way through this, that we closed down pretty tight to begin with, so that we could get things under control, so we could make sure that we could handle a surge in our hospitals, that we had the PPE that we needed, that we could get the testing that we needed up and running, that we could make sure that we had contact tracing that was available and adequate for this, and that when we were to that point, that we would look at our data and start to gradually reopen. But as we do that, we knew that we would open it in phases, not open everything 100% to begin with. Those higher risk areas like casinos and movie theaters or restaurants, we started more slowly with those. We have opened percentages wise with regards to our restaurants and bars and other areas. And we've been very consistent in our message, and that is the protection of those individuals that are at increased risk, the wearing of masks, the good hand hygiene, the social distancing to the best of your ability. So I think that the message has been very, very consistent.
Yeah, and I would just say that we can open more and more because we can. We're making the right investments in testing. We're making the right investments in tracing. We have the ability to treat those who are in need. So we wouldn't be consistent if we were scaling back or not opening, as we're monitoring the numbers locally on a day in, day out basis. And I think that does go to not just we as a state, but we as a people. And folks have been very patient. Folks have been, by and large, very persistent and team players. And that's a good formula for success to stay on this back on track plan. Joann's, I'm working on a framing project, and so I needed to get some supplies to do it myself. And I will tell you that I talked to 6 feet apart. I talked to everyone that I came in 6 feet of. And I think it had a lot to do with the mask that I wear has the state of Indiana on it. I thought I might just blend in when I was picking up my supplies to finish my project on a Sunday afternoon. But I think the mask gave me away.
Hope with the State House file.
Hello, Hope. Good afternoon.
Good afternoon. I have a couple quick questions. The first is for Governor Holcomb. Will you be attending the Republican National Convention in Jacksonville? Will you wear a mask? And should it be required to sign waivers saying that the party, the city of Jacksonville, and the Trump campaign cannot be sued if a person gets sick from COVID after being in the crowd? And the question is for Dr. Box. Do you think it's a good idea for people to attend a crowded convention?
I intend on attending in Jacksonville. I know the city well. I was stationed there when I was in the Navy. And I intend, as it stands right now. However, I intended on a lot of things over March, April, and May. And so I'm not making a lot of long-term plans and carving them into stone. So I'll remain here, as Hoosiers have, at least until we get up to stage 5. This gives me a good opportunity to say also, hope that going through stage 4, we will still be providing weekly updates. I think Wednesday makes a lot of sense. We can look back on what's happened over the weekend and the first part of the week, and we can look forward and project where we think we're going to be. So our next get-together, so to speak, will be next Wednesday, the 17th, and we'll just tentatively plan on the 24th and the 1st of July as we look at stage 5. You had a question about suing. I'll leave that up. I'll leave other venues in other states at other levels and other campaigns to make their own rules. And did she have a question for you? Or?
Right. Do I have concerns about a large convention?
Yes.
So a large amount of people in an enclosed space, of course, gives me some heartburn, but that's going to give any public health official some heartburn. And I think that, again, I'm concerned that individuals that are at high risk based on their age or their underlying health conditions may want to forego that convention. I also would say that individuals should wear masks, and I think they should, to the best of their ability, socially distance and make sure they wash their hands carefully.
That is not a nagging mom. That is a good doctor.
Rob Burgess, the Wabash Plain Dealer.
Good afternoon, Wabash.
Good afternoon, Governor. Happy Friday.
You too.
So there's been a lot of discussion lately about what the role of law enforcement should be. And one thing I've heard from all sides is that we often ask too much of police officers. They're often asked to fill in the immediate gaps where the rest of society has failed. I'm going to be asking the same thing of local law enforcement and other local officials, but from the state's perspective, are there situations where someone who specializes in a particular area, such as social work or mental health work, might be better equipped to first respond to certain situations, giving police more time to prevent and respond to things like violent crime? Are there areas in the budget where funds might be reallocated to help make this happen?
Superintendent Doug Carter may want to speak to this, but I can, while I'm buying him time up to the podium, we do. I mean, this is true in a lot of walks of life or a lot of professions. We ask a lot of our teachers. We ask a lot of our law enforcement officials to not just take on their primary duties, but a lot of collateral duties then get also dumped on them. We saw our National Guard, women and men who wear that uniform, called to do a lot of things that are out of the ordinary, trained for, but out of the ordinary. And so we absolutely, one of the things I'm most proud of this administration is the joint exercise nature that we approach every single day, the mission that we have, that we all have, agency by agency. So it's not unusual for us to be aligned in our ultimate mission, and that means the superintendent of the state police, Doug Carter in this case, and Dr. Sullivan at FSSA, or Dr. Box at Health, or our Department of Corrections, the Commissioner Doug Carter. We are all working together. Homeland Security, I'm just looking out at some of the leaders here in this administration, and it's hand in glove, and it's what do you need help with? And so absolutely, that's part of the whole, not just budget process, but that's the whole annual look forward on how can we improve. Superintendent, you want to add to that, and from a very personal perspective, if you would?
Well, Rob, I think I heard the question correctly. I thought you had asked if there should be a partnership with a mental health professional teaching law enforcement. The answer is yes. We have to be all things to all people until they don't want us to be. So all the partnerships that we can establish, whether that was with drug counseling, anger management, youth violence, that list can go on and on and on. But the issue associated with mental health oftentimes has a connector to everything that we deal with from the public spectrum. And not just the mental health issue, but we could go into the cultural issues, and that list can go on and on and on. So the answer is yes, and I appreciate you asking the question.
Brenda McLean.
I think Mike.
Dr. Kaufman, you want to add something because you're seeing things from a frontline windshield every day too.
Yes, sir. Thank you, Governor. I wanted to just expand your question just a little bit, Rob, because as you mentioned, redefining roles of public safety. This is something that we have been working on within the EMS community now for several years, and something that the governor himself added to the list of his top pillars to work for in the next year, and that's expanding the role of community paramedicine, or what we also refer to as mobile integrated healthcare. You asked specifically about mental health. We're seeing our EMS professionals expand to take on a greater role in mental health. For example, with our mobile integrated health community paramedicine program in Fishers, where the fire department is actively working to help expand mental health services to members within their own community. We're seeing places like the Crawfordsville Fire Department expand their community paramedicine program to deliver in-home substance abuse care to folks, to expand access to medical care for underserved pregnant women. So we are actively working to redefine the role of public health. And whether you're law enforcement, fire, EMS, those roles do overlap in many capacities. For example, our police officers are often the first responders on the scene of a cardiac arrest and can start CPR or deliver life-saving defibrillation to folks. So your question is excellent, and it fits right in with the governor's Next Level 2020 agenda, and we are actively looking and working forward to redefine that role, regardless of the branch of public safety that one might find themselves working in.
Thank you, Dr. Kaufman. You want to piggyback just on the importance of the local state partnership from your perch?
So the state-to-state partnership between Indiana State Department of Health and FSSA, making sure more people are covered for mental health services, making sure that more individuals have coverage for substance use disorder has tremendously helped. But as we look at this, our local public health are very actively engaged also in making sure that the services are available, that they can connect individuals in their communities to mental health services, to substance use disorder services, and working with us on the state level at the same time.
Thank you.
Brenda McLean, Western Wayne News.
Good afternoon.
Good afternoon. Thanks for taking my call.
Thank you.
Is there a site where we can access where Indiana is spending the CARES money? I'm particularly interested in PPE.
Yeah, our director of the Office of Management and Budget, Chris Johnston, is on his way up, who is overseeing the CARES Act dollars.
So I apologize, was your question with the CARES Act or a specific program within the CARES Act?
Actually, I'm just interested in whether it's being spent out of the CARES Act money or any money that's being spent on PPE, what companies that's being spent with the state of Indiana is spending.
I cannot speak to the exact companies that we're engaging to supply the PPE. But the Indiana Economic Development Corporation is where the marketplace portal is established, and businesses and other entities can access that website in order to get their PPE.
Yeah, and we can, Rachel, we can have Luke Basso at the Indiana Economic Development Corporation circle back and make sure they get the information they need.
Okay.
Abdul Hakim Shabazz, Indy Politics.
Happy Friday, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Governor, two questions for you. One on education. If reelected, how soon would you appoint the superintendent of public instruction to help teachers, parents kind of get sort of situated with school? And the other question is for stage 4. Am I clear that cars can have audiences in racing, but horses can't? And what's the difference between the two in stage 4?
They both can? So both of them should be able to have that. I thought maybe the parimutuel horse racing was limited. Jane?
Jane, you want to talk about spectators versus fans versus in a building versus outside a building?
Sure, Jane Jankowski on the governor's staff. Parimutuel horse racing can begin in stage 4, and as well raceways, karting, bicycling events are also allowed to start at 50% capacity. The parimutuel entities will start with no spectators in stage 4.
To answer your first question, I won't let grass grow. Rachel?
Casey Smith, The Associated Press.
Good afternoon, Casey.
Hi, good afternoon.
I have a question about education. With your administration planning a $103 million cut in higher ed funding for the coming year, should K through 12 schools also be expecting funding cuts? And if not, how is the state going to avoid taking such a step?
Well, we're working on, and Chris is making his way up here, but we're working pretty hard on this right now, and we will have more to elaborate on next Wednesday on this front. You're correct. We asked our institutions of higher education, world-class universities, to take a 7% haircut because of the pandemic. These are difficult decisions you don't want to make or like to make, but under these circumstances, we have to. We're working very hard to protect our K through 12 investment. I want every one of those kids to end up in one of those world-class higher education institutions. So, Chris, you want to talk about anything between now and next Wednesday that you can, and how we're approaching trying to avoid exactly what Casey alludes to?
Well, I think you captured the issue very well, sir. Like I mentioned earlier, there were certain provisions that we took immediately with, such as the cuts to spending cuts that we're asking the state agencies to achieve, along with some of the projects that we are suspending. I think when you look at education, that's a priority for all Hoosiers. And that's also reflected in the fact of what percentage of the state budget is made up by education. So K through 12 is 43% of the general fund budget. Higher ed is approximately 8 to 10% of the general fund budget. So right there alone, the commitment of those dollars, over 50% of the general fund budget goes to education. So unlike some of the other steps that we've already taken, I think what the governor is looking at and we are looking at to advise him is taking a very deliberate approach because of those priorities and making the best decisions we can with the information that we have. Obviously, with some of the things I had mentioned before, it's a very fluid situation. We understand that both higher ed and K through 12 administrators are looking for some certainty so that they can plan, but we want to, again, make those the best decisions we can with the best information we have.
Yeah, in a very timely way, but the shot clock, we get it. The shot clock is on, and that's why we're looking to come to some clarity by next Wednesday. I also say that when I mentioned tough decisions or difficult decisions, the kind that you don't like to make, we also went to, I'm looking at a bunch of leaders here in the state government, and we also went to every agency and said, we're starting with us, and we're looking for 15% savings. Before we got to higher education and 7%. So we're all in this together, and as Chris just mentioned, we're looking for some certainty in some very uncertain times. However, having said that, we're in a strong position, and we're doing everything that we can to protect the dollars that go into K through 12.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon, Governor. I have two questions for Dr. Box. One is, at this stage of the game, how would you recommend for someone then who's not in high risk and doesn't have any symptoms, how should that individual think about testing and getting tested and seeing, if at any time he or she is potentially positive for coronavirus without knowing it? And then my second question is, how do you expect that people in the public will be able to use the zip code data on the that you've just provided?
So Sherry, I guess what I would say is that a lot of people have asked me, have I gone and gotten tested? And I'm like, no, I haven't been ill. I haven't been symptomatic. I haven't been a direct contact of someone who's been ill. I really try to, socially distance, wear my mask, wash my hands. So, in the limited world that I live in, I don't feel like I've been concerned. Now, I did do some testing over the weekend and, potentially exposed myself there, but I had full PPE on at that point in time. So I think that's up to every single individual, and I don't feel the need to go and get tested for things that I'm not symptomatic for, and I am very careful. I always try to conduct myself around people who are in high-risk groups like I am infected. The second part of that was...
Local zip code, importance, how we use it.
Yeah,
how to use it?
you'd be surprised how many individuals are specifically interested in their particular zip codes, what the incidence of positive cases are, infection is in that area. And so I think that this will give a lot of information. I personally look at that as I look at some of our disparate populations or populations that I know are hit harder with this, and can focus on particular zip codes to see what those numbers are. And it may help direct some of the testing that I do, whether that is an Amish population or an African-American population or whatever. Dan, did you want to say?
I would add just one thing to people who are asymptomatic and considering getting tested. Also consider who you're going to spend time with. So, for instance, as long-term care facilities start to loosen up some of their restrictions, now doing outdoor visitation and essential family caregiver, if you're going to be spending time with folks who are high risk and vulnerable categories, that might also be an indication to potentially get tested even if you don't have symptoms.
Yeah, and I'll probably get in trouble for saying this, but Sherry, you should call Nikki Kelly offline. I think weeks ago she asked about the zip code information, so when you were going through the presentation, I thought that's the Nikki Kelly slide right there for zip codes. But I agree with you totally. It's important to know what's going on close to you.
People like their
and we look at it in a very granular or a very local level, but we also look at it holistically statewide, and that does affect, that radar affects and informs us.
Lauren Chapman, Indiana Public Broadcasting.
Good afternoon, Lauren.
Good afternoon, Governor. How's it going?
So far, so good.
I'm glad to hear it.
A lot of day left.
Yeah. So, of course, yesterday you announced what Stage 4 meant for recreational sports, and that contact sports may resume games or tournaments beginning Friday, June 19th. So what I want to know is why wait the extra week on contact sports? You know, what's going to change in the next 7 days? What's going to change in the next 7 days?
Well, I think with
Do you
regards,
have your crystal ball?
I think with the contact sports, especially with the kids, we ask for people to come up with plans about how they're going to help to protect those individuals that are competing and families that are coming to watch specifically. So we didn't want people to just automatically go, great, we can do it now today, and we want to make sure they had time to put a thought process behind that.
Demi Johnson, Wish TV.
Good afternoon. Thanks for joining us.
Hello, Governor. How are you?
Good. Yourself?
Good. So as we move into Stage 4, bars and nightclubs reopen, I'm wondering, do you think it's possible to socially distance in a bar or a nightclub? And as other states reopen, or I've seen in other states as they've reopened, several people flood to the bars and the nightclubs, and then they've kind of had to take a step back and start over. So I'm wondering how we can prevent that from happening here.
I'll let the doctor answer this, but the answer is yes, it's possible. And I also know there is a great temptation probably not to. But you can go into, as I have recently, into Joann's Fabrics, or you can go into an elevator and you can see how, or in a park, and you can see how folks have restructured the way they do business. And the services that they offer is being restructured to allow, and not just allow, but encourage that physical distancing. So yes, it's possible. And we're asking people to continue to be team players. This is when you look at all the states and where states are, the 20 that are trending down, the 10, about the middle 10 that are kind of holding steady, we're trending down, we're headed in the right direction, and about the 20 that are trending up. It has a lot to do with our behavior and the way that we hit this very early, and the way that we've been very disciplined and methodical, and not all at once, and not because maybe we could gamble on what would happen. We're being very thoughtful about this, and so we'll just ask whether you're a bar or a restaurant or a fabric store to work with us. It's contagious. It's community spread. And so we're going to have to work together. It's not just a egocentric, how do I approach my day? My actions affect everyone else. And that's why I think to date, we've been on a good course. You want to correct anything?
No, I agree with you, Governor. It can be done. If you ask me if I'm confident that the age group that will necessarily be partaking of being in bars for a long period of time, that those individuals will do that, I don't have that confidence necessarily. I hope they will, so that they don't take something home to grandma or to someone else in their family or their community, their church or wherever, and infect them.
And that's what we have to keep communicating, that point, that just because you'll be able to weather the storm doesn't mean if you become infected, that who you transmit it to, that's what we're trying to do, is manage the transmission rate of COVID-19. And to date, we're doing a pretty darn good job. But as these additional temptations, things that are right there, that are very luring, we have to do it responsibly.
That concludes today's briefing. Governor Holcomb's next briefing is scheduled for Wednesday at 2:30 p.m. Eastern.